Good afternoon. Thank you for joining us today. My name is Carlita Gotzi, and I'd like to welcome you all to the Ask the Expert educational series, Managing Challenging Classroom Behaviors in Early Elementary Students with ADHD. Today's webcast is part of CHAD's program with the National Resource Center on ADHD, Ask the Expert Educator Series. The NRC is funded by the U.S. Centers for Disease Control and Prevention and provides reliable, science-based information about current medical research in ADHD management. During this webinar, we would love to hear from you. You can ask questions, share comments at any time during the presentation, and Dr. Murray will answer all questions at the end of the presentation. There's a box labeled Resources where you're able to download the slides from today's presentation. Please keep in mind if we don't get to your question today, we have a wealth of information. You can also reach health information specialists that are available Monday through Friday between the hours of 1 and 5 p.m. Eastern Time. You can reach our health information specialist at 800-233-4050. And now I am pleased to introduce today's expert, Dr. Desiree Murray. Dr. Murray is a senior research scientist at the Frank Porter Graham Child Development Institute and associate research professor in the School of Education at the University of North Carolina at Chapel Hill. Prior to joining the Frank Porter Graham Child Development Institute in 2014, she was an associate professor in the Department of Psychiatry and Behavior Sciences at Duke Medical Center, where she served as Associate Director of the Duke ADHD program for 6 years. Dr. Murray's current research focuses on developing and evaluating self-regulation intervention in the schools. She's received approximately $8 million in funding for her work in the Institute of Education Sciences, the National Institute for Mental Health, and the Administration for Children and Families. Self-regulations, including Incredible Years Teacher Classroom Management Program. And now, for today's expert, Dr. Murray, Managing Challenging Classroom Behaviors in Early Elementary Students. Dr. Murray?
Thank you, Carlita. And just to clarify, I'm actually a psychologist by training and background, which means that I have spent a lot of time working with families in both a clinic setting as well as working with teachers in schools. And so that will be the topic for today, to think about hopefully what are some useful, helpful strategies for managing challenging behaviors and really setting up the classroom in ways that support students with ADHD behaviors. Just a brief disclosure that I am a mentor in the Incredible Years Teacher Classroom Management Program. Some of the concepts that I'm going to address today are based on that program. And as Carlita said, some of my funding comes from the Institute of Education Sciences. So the three areas that I wanted to address, actually 4 areas, is first off, just briefly thinking about some key concepts I think are important in terms of understanding ADHD behaviors in the classroom, which sort of inform some ways that you might want to think about approaching those. And then I'm going to talk a little bit about teaching self-regulation skills. First off, what self-regulation skills are, how they're useful for kids with ADHD, and how that may be beneficial as part of other strategies that you're using. And then I'll talk about proactive strategies that promote positive behaviors and how those work together with strategies for actually dealing with some challenging behaviors. And we'll have hopefully about 10 minutes to answer questions at the end. So to start off in thinking about what we know that may be helpful to think about in terms of ADHD in young students. The first thing I want to say is that this talk today is not specifically designed for students who have a formal diagnosis. Certainly, if students do, this will be relevant, but I also have framed this in a way that it will be relevant simply if you're working with students that you recognize some of these behaviors. So I'm not presenting formal DSM criteria here for ADHD, but I thought what might be more meaningful is actually thinking about what are some of the behaviors that teachers see in the classroom. Certainly some of the obvious things like trouble sitting still, not seeming to listen. What's actually interesting is that even though students with ADHD look like they're not listening, sometimes they actually are. Sometimes if you call on them, they actually will know the answer, even if it looked like they were completely somewhere else. And that actually is, speaking of symptoms, how the symptom of not listening is phrased in the DSM diagnostic manual. But there's a lot of other behaviors that I think can be challenging for teachers that are associated with ADHD and are worth thinking about for just a moment. So things like difficulty waiting and getting really easily frustrated, trouble sticking with tasks, following directions maybe is a little bit more obvious. Trouble following rules, and some of that may have to do with, as we'll talk about in a moment, really getting off track, getting distracted, and some of it may be, at least in the moment, actually forgetting what that rule is. Even if you stop them and pause them, they could probably recite what it is, but the impulsivity is really often what's driving some of the difficulty following rules and directions. And you, of course, see that in classwork as well, in terms of quality of work, perhaps not being what you think the student is capable of, oftentimes because they're rushing through and making a lot of careless errors. Then there's also a lot of behaviors that can be just challenging to manage in the classroom and bothersome for teachers as well as other students. Things that are impulsive and are reflect some hyperactivity, including noise making, talking a lot, blurting out, which is perhaps raising your hand, but calling out an answer before you get called upon to respond. Behaviors that sometimes just look like they're immature or silly behaviors that are, again, oftentimes driven by impulsivity or by some of the self-regulation difficulties that we're going to talk about. And sometimes some of that impulsivity can actually look aggressive. I know I had a student several years ago who had gotten in quite a bit of trouble at school because he had broken another student's skin with a pencil. And I believe there was a pretty serious suspension consequence for that. Clearly that was a pretty serious behavior that needed to be addressed in the classroom. But in this particular situation, the student actually did not want to harm that child. It was really an act of impulsivity more than aggression. And some of the other social behaviors that certainly contribute to difficulties we see with students with ADHD behaviors having trouble with friends. Perhaps they get along better with younger peers. They may be perceived as sort of intrusive or bossy or lacking in social skills. And as I've sort of given you a sense, the ADHD behaviors themselves are not willful or intentional. Now, where things get complicated is that for many students with ADHD, they also have other emotional, behavioral, or learning challenges that go along with ADHD. In fact, it's more the norm to have other difficulties than to have ADHD alone. And one of those very common difficulties is oppositional behavior, which, if that is significant, that could have more of an intentionality to it. But the ADHD behaviors themselves are generally not intended to be willful or intentional, and oftentimes the student will apologize and actually feel fairly remorseful afterwards. So what do I mean by self-regulation and self-regulation being delayed? Well, some of the things that we generally think of as reflecting self-regulation have to do with sustaining attention, being able to delay gratification. So obviously waiting for your turn, working hard to earn a reward, just inhibiting impulses that you know are not acceptable so that you can follow rules and do the things that you probably know you need to do. And also regulating emotions is an important part of self-regulation. So there's both a cognitive component, an emotional component, and a behavioral component to self-regulation. And broadly defined, those all of those things are have been in lots and lots of research shown to be pretty delayed in students with ADHD. Um, and it's interesting, some of you may follow Russell Barkley's work, and he's for many years has been speaking about students with ADHD being about 30% less mature than others. And just recently, with some of advances in technology, we've actually been able to look at differences on a group level between individuals with ADHD and those without. And in fact, some of the areas of the brain associated with self-regulation, like the frontal lobe in particular, have indeed been shown to be about 30% delayed in terms of some of the connections and even in terms of some of the brain size. So that's actually a pretty helpful rule of thumb. One of the implications of that is that if you have, let's say, an 8-year-old student in your classroom, that their ability to self-regulate in the way I've defined it is probably comparable to a child who's not quite 6. And if you think about it that way, some of the things that you see probably make sense. And in fact, the way you would approach a younger child is probably going to be helpful for that particular student. They're probably going to need more external structure and reminders and explicit instruction on behavior than certainly you would expect for a third grader. What complicates that even more, and has been highlighted in some recently publicized research, is that if in fact this 8-year-old is in third grade rather than in second grade, they're going to look even less mature because the norm in the classroom are going to be students who are older than them. So one of the bottom line, another important concept here in terms of understanding challenging ADHD behaviors, and this is also, I like to quote something from Russell Barkley here, is that ADHD can be described as a disorder of inconsistency. And what that means is that having ADHD does not mean that you can't do X, Y, or Z, sit and listen, for example. But what it does mean is that you can't do it all the time. You can't do it consistently because the ADHD sort of disconnects your knowledge from your ability to follow through. So that's helpful to keep in mind as we think about behavior management strategies. And this inconsistency is really quite frustrating to both parents and teachers. And because it's certainly logically, you might think, well, he can do it sometimes. So if he's not doing it this time, it seems like it is more intentional, whereas in fact, it's the variability that is part of the disorder itself and that inconsistency. Because of the difficulties with self-regulation I just described, part of what that means is that kids with ADHD are their behavior is more influenced by the situation and by the parents and teachers around them than it is for other children. And so what that means is that you may see behavior vary from situation to situation, and those behaviors are likely to be worse. Certainly, as anyone who works with young kids know, that anytime kids are tired or hungry, those behaviors are likely to be more challenging. But related specifically to executive functioning and self-regulation, anytime more challenging or complex tasks or tasks that require a lot of thought or persistence or organization, those are times that are going to be more challenging, and you may see more trouble focusing, more trouble staying on task, and following through, and even doing careful work. Also, if tasks are repetitive or boring. And again, this is going to be defined by the individual child in terms of their personal preferences and interests, but also their abilities. This is something that comes up sometimes with students with ADHD who are very bright. And in fact, some symptoms sometimes emerge because they're not engaged in the material. So that's something to think about as well. We can see the reverse situation, of course, too, when information and material is too challenging and hard to follow and process. You can also see some of those behaviors. That's certainly where sort of good general instructional practices are very relevant. The other place where difficulties tend to arise more often is in less structured situations, in particular when adults are not monitoring students. So one of the things that probably immediately comes to mind are transition times, and those are often times where students with ADHD behaviors may end up getting in trouble. So the implications of this, actually, on a broad level, is that the more situations are structured, when interactions with students are one-on-one versus in a large classroom, if material is novel and interesting and engaging and there's lots of reinforcement, you probably see fewer difficulties. So there are, given what I have been describing, it's easy to understand why a lot of typical management strategies don't work, or at least don't work as well with students with ADHD. We talked about the inconsistency and the delayed self-regulation, but another important issue here is that children with ADHD have trouble both anticipating and responding to consequences. So not only are they not stopping to think about, gosh, if I do this, then this is probably what will happen, so I better not. They're not pressing that pause button. But they also, which makes management challenging for teachers as well as parents, is that they're not responding to consequences in the same way as other kids. And one of the ways that they don't respond similarly is that the connection between the behavior, the thing that they did, and the consequences, whether that be a positive consequence of reward or a negative consequence like a discipline procedure, to the extent that those are delayed, that they occur several hours or the next day for early elementary students, the less likely that they're actually going to learn from that. So this is why one of the things we say to parents and teachers as well is that try to make your consequences as immediate as possible. That's a really important principle, and it applies to a lot of things about working with young students with ADHD. Another important principle of consequences is that students with ADHD generally need more learning trials. And what do I mean by that? Well, I think about young kids who need to learn the classroom rules and sort of appropriate social skills and behaviors. And we generally think that, first off, we know that there's a lot of variability in terms of how quickly different students learn those things, and it has to do with a lot of factors, both individual to them as well as to their prior experiences. But we think that typically for kind of social behavioral types of things, it might take, for example, 30 to 300 learning trials. We think of the student with ADHD, they're probably more like the student who's going to take 300 learning trials to actually learn something. And if the teacher is in fact the one dealing with that, that can be very frustrating, especially if some of those behaviors are interpreted as intentional or controllable when they may or may not be. And then another aspect which is important to consider in terms of strategies and approaches is that students with ADHD get bored with rewards easily. And so in order to maintain motivation with incentives, one of the things that we need to think about is how to keep those things novel and interesting. All right, so let's talk for a few minutes about teaching self-regulation skills. And one of the reasons I think this is important is because there are two major approaches that we think of in terms of effective treatments for ADHD. two that have been the most researched have been, of course, medication and also behavior management strategies, which we're certainly talking about today. But one of the things we know actually for both behavior management as well as for medication is that they actually tend to only work for as long as they're being implemented. And certainly that's fairly obvious with medication because of how short acting most of the stimulants are. But even for behavior management, we tend to find that if a system isn't in place, or if one teacher's rules are different, one teacher's rules and consequences are different from another teacher's rules and consequences, you see differences based upon what's being implemented. So one of the nice things about thinking about self-regulation skills is that these are actually something that we think kids can learn, that actually can influence their behavior over time as a learned behavior. And so there's several ways that we can think about teaching self-regulation skills. One of those is actually formal instruction, and there's certainly curricula that are available. I've mentioned a few of those here on the slide. The PATHS program, Second Step program, Incredible Years program, all of those have some evidence of efficacy for students with social, emotional, behavioral challenges, including students with ADHD. But there's other approaches for teaching these skills that don't require formal instruction. And in fact, there are ways in which the day-to-day interactions of students and their teachers and, of course, their parents actually, I think, can be more powerful. And so before I talk about what are some of the things that caregivers can do, let's look for just a minute at what do I mean specifically about some of those self-regulation skills that can be promoted and further developed, in particular, given that we know that there are delays in this area. So I think of those sort of both in terms of cognitive emotional self-regulation skills as well as more social behavioral skills. So the cognitive emotional includes things like persistence, and part of persistence is also problem solving when you run into difficulties, some flexible thinking. Being able to focus is a very basic sort of self-regulation skill, and a sort of higher order skill that most early elementary students are really just beginning to develop has to do with being able to self-evaluate behavior. And this is something that students with ADHD, again, are probably have some delays in, and so is in fact an area where teachers can promote those skills and provide sort of a lot more feedback, for example, than they would normally do for students of that age to assist in developing that particular skill. The emotion regulation skills are also quite important too, so I don't want to overlook that. Oftentimes students with ADHD have a lot of difficulties with frustration, or what parents and teachers sometimes might say, they're melting down, which is sometimes a very good description in terms of how that looks. And so some of the skills that we feel like are really important that underlie emotion regulation have to do with emotional literacy, or being able to recognize and notice and then articulate or verbalize the feelings that they are experiencing. And then the flip side of that, which is also very important, is recognizing those feelings in others. And this sort of is where this becomes a skill that influences social interactions as well. And then, of course, calm down strategies, which for young kids are oftentimes very, very important. And not just calming down from getting angry, but also calming down just when sort of the energy level or excitement or enthusiasm is too high, being able to sort of bring that down to a level that is appropriate in the classroom and that's manageable. And then some of the social behavioral regulation skills having to do with waiting for a turn. You can see the parallel here with the difficulties with impulsivity. So part of what is helpful to focus on is the skills involved in waiting, the skills involved in working slowly and carefully to do your best work, in pausing yourself before you grab something or touch someone or even give them a great big hug, to respect their space and ask permission to touch them first if you are going to touch them. I talked about using your words and that being important. One of the things we know about young kids is that the more that they are able to actually express how they're feeling in words, even if it's being frustrated or angry, the less that they need to actually act those out. And so this is often an area that students with ADHD are not is not a strength of theirs and is something to continue to encourage and support. Listening behaviors, obviously, and staying on track in the classroom with rules and routines. So, what are some ideas for things that teachers can do in the classroom to teach in what I like to call, and this is actually a term from the Incredible Years program, which has some resources on this specific strategy called coaching self-regulation. So, one of the things to think about is that uh, all the things that teachers know and do to teach literacy are actually probably equally relevant to teaching self-regulation. So that means being really explicit, systematic, and intentional about the skills that you teach. So really breaking it down and not trying to teach something that is too far above where the student is currently. And also really viewing this as something that can be taught. And all kids can develop skills with, but just like with literacy, some kids get it faster than others, and some kids need a whole lot more support and repetition to do that. And that would certainly apply to students with ADHD. But even things like modeling and then labeling and describing different self-regulation behaviors in the classroom, that's actually very useful because it helps those students be more aware and recognize those behaviors. And so this is where being very descriptive in your comments can be helpful too. So it can be very clear exactly what you mean by it. For example, instead of you really followed our rules today with cleaning up your table, saying something even more specific than that, like you put all the crayons in the red cup and you put the scissors away in the green cup. That's even more specific. And it's also actually, quite honestly, very reinforcing. That really reflects a lot of positive attention from a teacher that is going to be motivating and that students are going to pay attention to. And most young kids really work hard to continue to get that kind of attention. Certainly praise and incentives for some of those things, and lots of practice opportunities. And sometimes we think for again a good teaching tool is actually setting up situations so that students can be successful, where a teacher or a buddy in the classroom might actually be assisting them to be successful. Some example of some specific teaching methods. Well, I think broadly speaking, I think most folks who work with young kids know that auditory instruction is probably it actually is probably the method of instruction that most schools use more than any other. But in fact, we know for young kids and in particular for students with ADHD that that's probably the modality through which they learn the least. And so anytime we can think about teaching in ways that are visual or kinesthetic, so actually involve positive practices of skills, the more likely and the easier it is going to be for those students to learn those skills. So modeling would be visual, positive practices would be kinesthetic. Puppets are another tool that actually work great with young students with ADHD. We use these in our program through kids certainly through second grade, and some third graders are pretty engaged too. And one of the benefits, as you can see in this picture, is that they're really engaging to kids. They're a very useful tool that can also the puppet can demonstrate skills, and the kids can do positive practices and actually be reinforced by the puppet. The other tool that you see here in this picture, which is very useful for students with ADHD as a reminder and redirection, as well as a teaching tool, are to have visual aids. And again, because the auditory is probably not going to be as effective, given that we know listening is a weakness. So I mentioned calm down strategies being important for a variety of reasons, and these are just some examples of specific calm down strategies. There's a number of programs in schools that are focusing on yoga and mindfulness techniques, and there are a few studies that have started looking at this with students with ADHD. They are sort of interesting and perhaps promising. The research is still very limited, but I know these are things that largely have been found helpful for students, even young students. So a lot of schools and teachers are exploring that in their classrooms. Certainly a strategy that many teachers are probably familiar with and already use have to do with deep breathing. We prompt our kids to breathe as if they are smelling the flower when they breathe in, and blowing out the candle and looking at their belly to see if their belly is going up and down, and that's called belly breathing. And there's other strategies as well. Going into your turtle shell is a particularly useful one, I think, for young kids. Positive self-talk can be, but I think takes a lot of practice for young kids as well. This is just an example of a calm down area. So when students are getting either very, very upset or very wound up, and physically they may need a space to calm down. So some teachers find a lot of success with providing an area for students to do this. I do want to make an important point that a calm down area is different than a timeout area. I'm going to mention timeout in just a bit, and I want to be clear that calming down is something that you want to encourage students to do, so it's actually not a punishment. All right, so what are some proactive strategies, some things you can do to set up your class? This first slide is just sort of summarizing what an ADHD-friendly class might look like. So for a parent, as they are wondering who their student's next year teacher might be, parents would often ask me, what kind of teacher, does my son need, or daughter, perhaps. And this is sort of a nice summary of what an ADHD-friendly class would look like if you walked in. So the teaching style would be structured, but there would also be flexibility with that. So some individual accommodation and flexibility for accommodating the student's needs. Seating would minimize distractions and allow frequent monitoring. So a couple of comments about that. Oftentimes in classrooms today, there's sort of group seating, which is on the one hand really nice in terms of encouraging collaboration, which is a 21st century learning skill, of course. But that kind of setup actually provides a lot of distraction. So I know some teachers sort of go to the other extreme, and they've actually removed the student with the ADHD behaviors to sit by themselves or in a corner or something that actually can sometimes feel it can actually reduce motivation and can sometimes have a negative impact on self-esteem. So as funny as it sounds, one of the best structures for students with ADHD actually is a super traditional seating in rows, which again, all classrooms that may not work given other goals that you have, but it is worth thinking about where can a student with ADHD be seated so that distractions are minimized and so that you as a teacher can actually frequently monitor them without them feeling like they're being punished. Having clear routines and organized materials. So as it generally said, the more organized the teacher, the better organized the student with ADHD will be. And a lot of rates of positive feedback and positive reinforcement, again, because students with ADHD are not monitoring themselves. They sort of need this additional layer of feedback, and positive reinforcement is, of course, going to be more motivating than punishment. I think we've talked about the other things here. So engaging students, this is important because, of course, when students aren't engaged, that can lead to more challenging behavior. So the more teachers can do to keep students engaged, And these are just some proactive things that again is probably a review for most teachers who are listening. One of the simple things that is hard to implement, I think, sometimes is thinking about, well, what is actually the length of this child's attention span? And if it's really only 5 or 10 minutes, then the instructional time should really not be more than 5 or 10 minutes without allowing for some sort of wiggle break or providing the child with a way to really be actively involved, be a helper, have a special role. Um, there's certainly other strategies that can be used to help support engagement and increase attention to instruction. Nonverbal cue cards, like we were looking at earlier, are very helpful. Teaching kids, simple strategies like 1, 2, 3, eyes on me. We think of that as sort of a strategy for younger students, but again, early elementary students with ADHD their self-regulation may in fact more likely resemble a student in preschool than a kindergartner or first grader. So I mentioned maximizing positive feedback, and one of the specific strategies that I like to encourage is catching the student being good. This is simple in theory, but harder to do, I think, because naturally teachers, and really this is not just teachers, this is sort of all of us. I think we are built to pay attention to difficulties and concerns in our environment, and we tend to notice negative behaviors more than we notice positive behaviors. And one of the things that can really lead to a negative spiral of behavior in the classroom is when students with ADHD just feel like they're in a hole and their teacher doesn't like them. So I would never underestimate the power of that positive feedback. Not only positive, but also lots of feedback, letting students know when they're on track, telling them, like the example I gave earlier, specifically what they are doing right. You worked so hard to write your name, you got it on the lines, you were very friendly, you shared, with so and so who's next to you. You packed up all the books you needed for your homework in your bag. Being really specific and noticing those things in a way that, again, we might not think that as adults we should have to, but considering the self-regulation delays, it in fact is really important and perhaps almost critical. One of the things we also know about positive feedback with students with ADHD is that we sometimes say that you need a megaphone so that they can hear your feedback and even to hear your praise. And so what we mean by that is that you really sometimes have to make sure that they're listening to you before you give them feedback and praise. So you may need to get their eye contact. And the other thing I would encourage is really praising that effort and improvement, not just accomplishment. And a rule of thumb, which is sometimes helpful if teachers want to even sort of keep track of themselves for a day or a class period with a student who has been challenging for them, just keep a list and see how often am I giving redirections or corrections versus positive feedback. And that may be an interesting exercise for thinking about ways to shift that. So incentives can be really helpful. I will make a comment that we really just used incentives as behavioral scaffolding to help students learn to a particular rule or a particular behavior. And then our goal is always to fade that out. But in fact, even though we would like students with ADHD to be internally motivated, that is in fact the thing that they have not yet developed very well. And so this is where incentives can be very useful. I'm not going to say a whole lot about this other than some of the challenges with incentives and consequences that I noted earlier, which is that students tend to get tired or bored with things. So one of the things to think about is having a reward menu or having a prize box or something like that, which will keep things interesting. One of the programs I worked with previously would rotate reward menus every 2 or 3 weeks. So that every 2 or 3 weeks, there'll be a whole new list of things that could be earned. And again, for generalizability and to be able to fade out these incentives, a couple things I would suggest is always make sure that anytime you're awarding an incentive that you're combining that with praise and that you're working towards having incentives be more activity-based than tangible things like prize boxes. And the other recommendation is that for young kids, anyway, we actually recommend that those sort of incentive systems be kept separate from punishment systems rather than having students sort of go up and down within the same system. And that is often because it's so easy for students with ADHD to get discouraged and to not be successful with those things and to have it feel like they've earned something and now it's been taken away. Probably the single most effective behavioral intervention for ADHD at school is a daily behavior report card. I'm going to show you an example in a moment and talk about how this might look to implement that in the classroom. And I think I will show you an example in order to talk about some of these specific principles. So if you notice, there's just a limited number of target behaviors here, and they are all worded positively. So they are worded as what to do. And they're also very specific in terms of the criteria. So 2 or less reminders, 80% of work. The other thing this represents is that if a child is struggling with something, we don't set a goal that is, well, now he's never going to have this difficulty ever in order to achieve this reward. We actually try and set the goal at a level where with some effort it can be achievable. And if one wants to be really scientific about that, they could think about sort of a 30% improvement. The other thing that is really important in terms of using a daily report card is that it is really used in the context of what I was saying before, which is a lot of positively framed teacher feedback. So again, one of the dangers of a system like this where it can go awry is where feedback focuses on the no's, especially if there's fewer no's than yeses, where it really is so important for motivating students to focus on what they did and their accomplishments, and that any discussion of the no's may be focused around, number one, what the student's own self-awareness was and how they might want to work to earn that with another opportunity. So they're given a fresh start and another opportunity to be successful. In an ideal situation, this is something that would go home. Sometimes parents will actually work to set up a reward system at home. In all situations, that's not possible. So it's certainly reasonable that some sort of reward could be provided by the teacher or perhaps even somebody else in the school. I think I addressed giving some of the DRC feedback, and I'm going to move along. This is a nice resource if somebody is interested in actually developing a daily report card. You might want to check out this website, interventioncentral.com. So I'm going to move along to managing challenging behaviors and some strategies and tools for that. So as I've been talking, it really is the teacher relationship and the positive proactive strategies they're actually the foundation for an effective behavior management system. The more time that teachers spend correcting and disciplining students, actually the worse behavior tends to be. And so all these things that we've talked about in terms of expectations and instructions being clear and specific, frequent positive feedback, lots of praise, powerful, meaningful, and variable incentives, all of that actually will reduce the frequency of negative behavior. So these are things that really do need to be in place before any sort of discipline strategies are used. And then if we're thinking about discipline, we're thinking about some principles that are very similar to what we talked about with our proactive strategies. So we're thinking about immediacy, which we mentioned earlier. Another thing to think about is that, and there's actually research showing this specifically, that for students with ADHD, smaller, more frequent consequences are better than larger, bigger things being taken away. They're less likely to learn from that, and again, more likely to be disheartened, discouraged, and unmotivated than if it's a small thing. And I'll give you some examples in a moment. Related to that is that there should be ahead of time some thought about, for example, if privilege removal is being used, what is the maximum that actually might be taken away, and make sure that if that's reached, that no more is lost. Consistent follow through is important, and the other piece, which is true for any discipline that teachers know, is keeping your cool, which is something that teachers may want to have their own calm down strategies when they're getting frustrated with the students, so that they can follow through and implement some of these strategies. They'll actually work better. And I think that is certainly related to avoiding a power struggle, because power struggles are just something I think no one intends to get caught up in, but when we lose our cool, it's easy to stick your foot in it. So simple, the sort of first line strategy for dealing with inappropriate behaviors, I would say, is simply redirecting the student. And I would try and do those redirections in ways that are positive. So for example, one strategy that's very simple and very powerful is, if you see that student with ADHD doing something that's, they'll say they're not sitting correctly or they're calling out, instead of commenting to that student, what you might do is to say to the student next to them, wow, so and so, I really like how you have raised your hand. I'm going to call on you, and I'm going to be looking for people who are sitting crisscross applesauce on the carpet, or whatever the particular behavior is. Here's where nonverbal redirections can come in very handy. They help to prevent students from sort of being labeled as bad kids when we're not calling their names out for misbehavior all the time. When we do have to redirect them verbally, telling them what we want them to do instead of what we want them to stop doing. And again, sort of trying to keep our emotions out of it will help be more effective. Examples of privileges. So privilege removal and timeout are sort of two strategies that can be used above and beyond redirection. Privilege removal, some examples, we try to make things that are as logically connected to the behavior as possible. So for example, if you don't use materials appropriately, we'll take them away. If you do not line up properly, you'll have to go to the end of the line. Sometimes we don't always have things that are quite so logically connected, and so we do things like you'll lose 1 minute of your favorite activity. Again, the more we can make that same day or very close in the future, the more effective they're going to be. If we say, for example, you'll miss some recess time tomorrow, and then in fact it's a strategy that many schools can't even use. It's not allowable. And it's probably not the most helpful, given that we want them to have that physical activity anyway. But the closer in time we can have the loss of that privilege, the better. We also need to think about, is the student really capable of doing this before we implement a consequence? And if we think about hyperactive and impulsive behaviors, that may or may not always be true. The other thing is, if our goal is to help kids learn positive and appropriate behaviors, we do want them to follow the rules. So if we can tell them ahead of time what the consequences will be if they forget the rule or don't follow the rule, then that's going to be a more powerful learning opportunity. And this is where also sometimes we may decide to give kids choices. So you can choose to walk across the classroom and pick up the things you knocked over, or you can choose to lose 3 minutes of computer time. Timeout can be very effective as a way to teach kids to calm down, but it really needs to be used sparingly. And I would suggest that if this is something that seems like it might be useful for a particular student, that a teacher consult with their behavior specialist or perhaps their counselors to think about how to set it up, because there's a lot of ways in which timeout can go awry. It's not always so easy to implement in the classroom, and certainly this is something by the time kids to get to be in older elementary school is not going to be as appropriate developmentally anyway. But there's some things that can be done to make sure that students are taught to do that ahead of time, and where its use is really minimized, that it's kept very short, and it's not used as something that kids will need to apologize for per se, but that the goal is to simply to really calm them down rather than have them pay for their crime or teach them a lesson. But it's really to simply give them the time and space to help them use some self-regulation strategies to calm down, and then they're really welcome back and given an opportunity to be successful and get some positive attention as well. So what doesn't help? Lots of negative attention doesn't help for some of the reasons I already talked about, pointing out what the student is doing wrong, asking them why they're misbehaving. This is sort of, it's very understandable, but students, particularly students with ADHD, are not going to know that, and they're probably just going to feel bad when they don't have a response. Avoiding the power struggle. Sending students to the office typically is not something that improves behavior. I do understand that schools have rules around that, but if the goal is to change the behavior, that's probably not the strategy that's going to accomplish that. All right, so just to wrap up with some key points. Students work harder when they have a positive relationship with their teachers. So that's really foundational and something that is probably harder with students with ADHD, but something I would encourage you to think about. Proactive is more effective than reactive. So the more you can do to prevent the problem, the easier it's going to be. So if you can change the situation or your manner of instruction or how you're interacting with the student, the less likely you are to have any problems. All that being considered, we know that ADHD is a chronic disorder. So that means that our supports need to be long term. And again, here's where when a situation or a student is really frustrating, it makes sense to kind of reach out to other student support staff in the school. And finally, just to keep in mind and keep encouragement that no strategy is going to work 100% of the time. In fact, as I said earlier, ADHD is a disorder of inconsistency. And so kind of expect that, and also expect that even if you see some positive effects with a strategy, that there may be some wearing off. So you'll need to keep working with new strategies over time. And have realistic expectations. And again, the more you can sort of have support and conversation with the parents and support and conversation from others in your school, the easier I think that will be. So that's it for my formal presentation. I know there's not a lot of time for questions, but I'm happy to take a few if anyone has any.
Great. Thank you very much, Dr. Mary. I think you've provided our audience with a lot of helpful information for managing classroom behaviors. I appreciate you being here today. And we're going to jump right into our questions. So, can you speak a little bit about the hyperactive child who may have a lot of energy and may just not be able to um, self-regulate appropriately? Can you give us a few more strategies about what we can do to redirect that behavior?
Yeah, so the student and young students in particular, some of them can have very significant hyperactivity, not being able to sit or stop moving, and that may also apply to being loud as well. So some of the strategies that I mentioned, I think would be really effective, have to do with having a calm down area for that student, and then number two, kind of teaching that student some strategies and some awareness of sort of where their thermometer is. Different programs talk about sort of, might have, a red, yellow, green level for kind of showing where your engine is, or a thermometer. So some sort of visual cue is often effective for increasing that awareness. You may
Sure.
find that for young kids, you will need to notice that for them. So if you see them getting wound up or needing to take a moment to calm down, you might say, it looks like your engine is running really high. It looks like it's on 10, or it looks like it's in the danger zone. I think you need to do some things to calm down. Would you like to go to the calm down area? Would you like to take 3 deep breaths with me? Would you like to count to 10? Those are going to be some helpful strategies for that student. And I think, as the question implied, that's going to be a challenging student to stay positive with your redirection, recognizing that they are going to need a lot of redirection. So the more you can actually look for opportunities when they are on track and give them that feedback. So if a student is really loud and not calm, one of the things I would be looking for intentionally is anytime they actually are quiet and are in their seat and
Right.
are calm, I would notice that and praise that quite a bit.
Excellent. Thank you so much for that. You mentioned the calm down stations. Are you seeing any particular trends in the classroom or how classrooms may be set up lately?
Well, I see that a lot in preschool classrooms because I think preschool teachers often think, well, gosh, we need to teach self-regulation. I think I see it less in elementary school because we tend to think, well, you're in kindergarten or first grade now, so you should know these skills. And in fact, students with ADHD don't yet. But I think some of the same things that we would think about in terms of providing a space which the goal can be sometimes some rules has to be set up around the space so that there's not a manipulation of use of the space. I have seen that happen
Of course.
where students are going there to avoid work, for example.
It looks very comfortable, I'm sure.
Yes, yes. So sometimes some rules will need to be put in place. And the other thing I think that is important is that if you have a space, you also want to teach some strategies because the idea is if they're going to the space, they're doing something. And so most students are not going to know what that is that they're supposed to do unless you teach them. You might say, go calm down, but they may not know how to calm down. And so coming up with 2 or 3 strategies for how to do that and maybe having some tools or aids or visual reminders of that can be very helpful.
That's good. That's good information, definitely. Now, let me ask, we'll take our last question here. You said earlier in the presentation that it's important to have consequences immediately. Do you have any tips you can share with our audience? What are some alternatives if the consequence cannot be presented in a timely manner?
Yeah, so that's a really good question because the reality is there are situations in which that simply can't happen, given the reality of the situation. So one of the ways you can do that is general principle actually is to try and make that consequence a reminder of a consequence as concrete as possible. So, for example, one of the things that we did in a program is that if there was going to be a consequence or loss of a privilege that, let's say, was not going to occur until the next day, or even perhaps later in the day, there might be like an index card where there would be an X or a number, 3 minutes off of whatever, favorite activity time they had. And that would be written down for the student in a way that they would see and know that this happened and that in fact the next day or whatever that time is, they needed to take care of that. And again,
Gotcha.
as soon as possible, and given the reality of the situation, will be better. I do know that there have even been some teachers who've actually been creative in terms of coming up with additional privileges for students so that they will have something immediate that
That's good.
actually can be lost. So something like having golden time in the classroom where students bring in a favorite toy and then every now and then the teacher will say, we're going to have 5 or 10 minutes of golden time to play with the extra special activities or
Yeah.
puzzles or whatever. And then in fact, that could be something that could be removed as a privilege. So sometimes teachers have to get really creative.
Like a lunch bunch. I know my daughter enjoys having a lunch bunch with the teachers, so that's great. I like that very much. Well, I think that's all the time that we have today. Thank you so much, Dr. Murray, for your presentation and your time today. I want to also thank our audience for joining us. Um, Dr. Murray, your presentation was very beneficial for us. I hope that our audience has enjoyed today's presentation. You'll be able to see the webcast again and others just like it on our website at help4adhd.org/ask the expert. Again, that's help the number 4 adhd.org/ask the expert. Now, as we close out, I'm going to ask if you could please take a moment, share your feedback with us. We'd like to know what you think. We certainly value your input and suggestions, and we use that information you give us to go about making changes and improving topics in the future for the webinars. Thank you again, Dr. Murray.
Yeah.
That concludes our webinar for today.